Hello, my name is June Rogers and I'm a specialist children's nurse. This little video is all about bedwetting and the treatments and what can be done to help bedwetting better. Lots of children have a problem with bedwetting, sometimes called nocturnal enuresis, so you are not the only one. If you are aged 5 years or older and still wetting the bed, then there are lots of things that can be done to help you get dry at night. To help your bladder learn to hold on to your wee for longer, you need to have at least 6 drinks every day. Water-based drinks are best, and try to have 3 of those drinks in school. Some children find drinks that are fizzy or contain caffeine, such as cola, hot chocolate and some energy drinks, can make their bedwetting worse. Try to avoid these drinks and experiment to see if there are other drinks that affect your bedwetting. Make sure you go for a wee before you go to bed so your bladder is empty for when you go asleep. If you don't go to sleep straight away and awake for more than about 30 minutes after going to bed, then try and do another wee before you turn the light off. So there are lots of things that you can do to help improve the bedwetting. Make sure you have at least 6 water-based drinks every day, with your last drink an hour before bed. Make sure you do a wee before you go to bed. And if you stay awake for more than about half an hour, then try and have another wee before you turn the light out. Make sure you eat lots of fruit and vegetables and take exercise to help prevent constipation. It's helpful to keep a record of all your drinks as well as your wees and poos to monitor your progress. If you wake up in the night for a wee and the bathroom is not nearby, then have a potty or bucket in your room that you can use. If despite doing all these things the bedwetting doesn't improve, there are 2 main treatment options available, either medication or a wetting alarm. However, it is important to see your nurse or GP first and have an assessment. This is because it is important to try and find out what the main cause of your bedwetting is. This enables them to help you and your mum and dad or carer choose the treatment that will hopefully work best for you. The 2 treatments available, medication or alarm. The medication is called desmopressin, which helps top up the lack of natural chemical messenger vasopressin. It is helpful for children who are thought to make too much wee at night. There are different types of wetting alarms. This is a picture of a body alarm. Your nurse or GP will help you decide if this is the best treatment for you. If you take desmopressin, if possible, try and take it an hour or so before bedtime, as this gives it time to work before you go to sleep. If you have the desmopressin in the melt form, called Desmomelt, you will not need a drink to take it. If you are taking desmopressin, then you must have your last drink an hour before you take it. So for example, if you take your medication at 7 o'clock, then your last drink should be at 6 o'clock. The leaflet that comes with the medication has more information and your doctor or nurse can explain more about it. This picture shows a bed alarm, but body-worn alarms are also available. You may need help from your mum, dad or carer when you first start to use them. The alarm will sound as soon as you start to wet the bed. It is important to try and wake up as soon as you hear the sound, then turn the alarm off and go to the toilet. Don't worry if you don't wake up straight away, as it can take a few weeks for the treatment to start to work. So I hope you now have a better understanding a bit more about some of the things that can be done to help the bedwetting better. If you want to know more about bedwetting and about all the treatments available, then do speak to your local nurse, health visitor or GP. Bladder and Bowel UK is a national charity and we have lots of resources on our website and a special helpline when you can get further advice and information from specialist nurses. So do feel free to give us a call or get in touch.